Paula sat in front of me, overwhelmed, sleep deprived, tearful, emotionally exhausted. She said, I think I'm about to lose my marriage and I don't even know how I got here. She wasn't being physically abused. There was no major betrayal, but something deeply intimate have been fading for years, and now it felt irreversible. They have been married for over 10 years. In the beginning, intimacy was mutual, even joyful, but with time, something changed in her. She stopped feeling desire. She felt disconnected from her own body, from her sensuality. She never initiated intimacy, and when he did, she felt tense, anxious, not because of pain, but because she didn't want it. She would give in sometimes, not from love or passion, but from guilty. And secretly, she felt relief on the nights he didn't approach her. Months passed between encounters. They barely spoke or touched each other anymore. Eventually, he stopped trying. He felt rejected, unwanted, and unloved. Then came the hardest part. He told her he was considering leaving. And that's when she broke. Not because of anger, but because she realized she might lose a man she truly loved. Because of a part of her she didn't understand, her sexuality. To women who feel unloved, to men who feel rejected, to the couples who feel distant because of this video is for you. Hello everyone, I'm Dr. Katia Batista, psychiatrist. Today I want to talk about a subject that's rarely addressed openly, yet is one of the most common sources of silent suffering in relationships: sexual dysfunction. Low sexual desire, painful intimacy, lack of arousal or pleasure. These are not just bedroom issues. They affect mental health, emotional connection, even one's sense of self-worth. In this video, I'll explore how sexual dysfunctions impacts relationships, how it links to anxiety, depression, shame, and emotional isolation, and how, despite being a taboo, is treatable. Your sexuality matters, and talking about it with honesty and respect is the first step toward healing. In many cultures, sex is a taboo topic. It's rarely discussed, especially in marriage. No one tells you how to talk about it. No one prepares you for it. I've met women married for years who've never had a conversation about their own pleasure. Men who feel ashamed for having sexual dysfunctions, so they just stay silent. The result: a lot of people are suffering, like I said, quietly. According to the World Health Organization, sexual health is part of mental well-being. After hearing this case, we ask ourselves a deeper question. How much does sexual health influence the emotional well-being of a person and the stability of a couple? The answer is more than we think. Sexuality is not just about intimacy, it's about connection, communication, identity, vulnerability, and even emotional safety within the relationship. When that part of the relationship breaks down, it doesn't just stay in the bedroom. Believe me, it spills into everyday life, into how we talk, how we feel, and how we connect with our partner, and ultimately, how we see ourselves. And yet, many women and men suffer in silence. They don't understand what's happening. They feel alone, ashamed, or even guilty. They don't know it has a name. They don't know it has a treatment. They don't even know it's valid to seek help for something that society keep quiet. So today, as a psychiatrist, I want to talk about something that's both common and often misunderstood. Sexual dysfunction. It's not about blame, it's not about labeling, it's about giving people a language to describe what they are going through and creating a space for healing, connection, and mental well-being. Let's start by understanding how sexual response actually works. This is not just biology, this is also about psychology, emotions, and relationships dynamics. The sexual response cycle, according to Masters and Johnson, has four key phases. The first one, desire. This is where it all begins. The interest or urge to be intimate is psychological, emotional. It can be influenced by stress, mental health, self-esteem, relationship issues, hormones, even medication. The second one, arousal. The body response. Blood flow increases, lubrication occurs, the heart rate goes up. Emotionally, there is excitement, anticipation, and connection. The third one, orgasm, a brief release of sexual tension, is physical, yes, but is also deeply emotional and psychological. When this phase doesn't happen or doesn't feel satisfying, frustration and sadness often follow. And the last one, resolution. The body returns to its resting state. Emotionally, this phase can bring closeness and satisfaction, or in some cases, discomfort and disconnection. When something disrupts one or more of these phases, we start talking about sexual dysfunction, and it's more common than we think. So, let's take a closer look at some of the most frequent types of dysfunctions, starting with women's. In this video, we will talk about women's. In the following ones, I will touch in men's. The DSM-5 classifies female sexual dysfunction primarily into categories. Let's talk about female sexual interest arousal disorder. This is when there is a persistent lack of sexual desire, thoughts or fantasies, and a reduced response to sexual stimulation. It's not just low libido. It often comes with distress, change, and tension in the relationship. This is what the woman in our case was experiencing. She wasn't avoiding sex just because, but she had no interest, no inner drive. And when intimacy happened, there was no pleasure, only obligation. This can be linked to hormonal changes, mental health issues like depression or anxiety, trauma or relationship conflict. Other category is female orgasmic disorder. This refers to difficulty reaching orgasm or a significant delay despite adequate stimulation. Some women have never experienced orgasm in their lives, and they often blame themselves when in fact it's a diagnosable, treatable condition. The other category is genitopelvic pain, penetration disorder. This includes pain during intercourse, dyspareunia, involuntary muscle tightening, or fear and anxiety about penetration. It can result in complete avoidance of intimacy and deep emotional distress. These disorders must cause clinically significant distress to be diagnosed, and they are more common than we talk about because of stigma, silence, and lack of sexual education. But here's the good news. They are treatable with the right support. Sexual dysfunction is not just a matter of relationships problems, like I said before, or emotional distance. It can be a clinical condition, one that can both stem from and lead to serious mental health disorders. And let's talk about that. A chronic lack of sexual desire, pain during intercourse, or the inability to feel pleasure can create a deep sense of isolation, guilt, or even inadequacy. Over time, this can evolve into major depressive disorder, generalized anxiety, sleep disturbances, low self-esteem, and in some cases, substance use disorder as a way to cope with emotional or relational pain. Some women even start to dissociate dissociate from their body, losing the connection between emotional intimacy and physical closeness. On the other hand, many psychiatric conditions cause sexual dysfunction. In depression, libido is often significantly reduced. In anxiety, performance fears and tension prevent arousal. In PTSD, post-traumatic stress disorder, especially in those with a story of sexual trauma, intimacy can become a trigger. But before we close this conversation, there is something very important I want to highlight. So far, we have focused mostly on the psychological and emotional factors that can affect a woman's sexual desire and functioning. Emotional health is deeply connected to our sexual well-being, but is not the full picture. There are also physical health conditions and medications that can significantly impact a woman's sexual function. And knowing this, not about placing blame, is about awareness and seeking proper support. Cardiovascular diseases. Conditions like hypertension can reduce blood flow to the pelvic region, which may affect arousal and make it difficult to feel physical pleasure. Diabetes. Diabetes can damage nerves and blood vessels, which are essential for sexual response. It can also lead to vaginal dryness or loss of sensation. Polycystic ovary syndrome affects hormonal balance, including testosterone levels, which play a role in sexual desires. Women with this condition often report lower libido and discomfort during sex. Thyroid disorders. Both hypothyroidism and hyperthyroidism can affect mood, energy levels, and hormone regulation, all of which influence sexual function. Chronic pain conditions like fibromyalgia, endometriosis, or other conditions which can make physical intimacy painful or emotionally distressing. Menopause is a natural stage. The hormonal changes of menopause, especially the drop in estrogen, can lead to vaginal dryness, thinning of vaginal tissue, and decreased libido. And beyond medical conditions, there are also medications, even life-saving ones, that can affect sexual function in women. Antidepressants, especially SSRI, are known to decrease libido, delay orgasm, or reduce arousal. Antihypertensive, like beta blocker, may impact blood flow and desire. Hormonal treatments, including some forms of birth control, can interfere with libido in some women's. Chemotherapy and cancer treatments may affect hormonal levels, body image, and desire. But Here's the key message. If you are experiencing sexual side effects, don't stop your medications without medical guidance. Talk to your doctor. There are often options, adjustments, alternatives, or supportive treatment. So, what can women do when facing this? Here are some clinical and practical steps. The first one that I will advise, talk to a professional. Don't wait until the relationship is on the edge. Sexual dysfunction is treatable. The second advice that I will give you today, improve communication with your partner. Many couples suffer in silence, and silence breeds distance. If you are going through something like this, it's not just your problem, it's a couple issue. Let your partner know how you are feeling. Talk about what you are struggling with. Use phrases like, I'm not avoiding you. I'm trying to understand what's happening to me. This is not about you. I want us to work through this together and start a honest conversation. Being honest is not weakness, it's a form of intimacy, because when your partner knows the truth, they can become ally in the process instead of feeling rejected or confused. Understand your body. Many women don't know their own anatomy, and many men don't either. Sexual arousal in women is not instant. It's not a switch. It's a process. There are phases already I explained before in this video. Desire, arousal, orgasm, resolution. Without proper stimulation, mental and physical, a woman may not reach the stage of arousal. This can lead to discomfort, disconnection, or even pain. That's why it's essential to learn what your body needs. Not everything starts with touch. Sometimes it starts with feeling safe, emotionally connected, and relaxed. And that's true for both partners. Kegel exercises and pelvic floor awareness help strengthen the pelvic floor muscles, which play a key role in sexual pleasure and control. They can increase blood flow, improve orgasm intensity, reduce pain during intercourse, enhance control and sensation. They are simple. Contract the muscle you will use to stop urination. Hold for a few seconds, then release. Do a few sets daily. It's a gentle, natural way to reconnect with your body. Bonus tip: don't rush into sex. One common issue is starting a sexual relationship too early, before there is true emotional safety or understanding that can create pressure, anxiety, and unmet expectation. Take your time, build trust, build emotional intimacy. Because when you feel emotional secure, your body is more likely to respond physically. Sexuality is not just about technique, it's about presence, attention, safety, and connection. When we don't talk about it, people assume something is wrong with them, with their body, with their identity, their worth. When intimacy fades, misunderstandings grow. Couples begin to feel disconnected, lonely, unwanted. Some start withdrawing. Some seek affection elsewhere, not always out of desire, but out of desperation. Remember, the problem is not always lack of love, it's lack of communication, especially around sex. We can start by normalizing this conversation by saying what was never said to us. Sexual health is part of mental health. It matters. And it's okay to talk about it. For couples, talk about your needs with love and openness. Don't assume, ask, listen, understand. Don't guess. Seek help. A psychiatrist, a sex therapist, a counselor can help guide the way. Many issues are not moral or personal, they are medical, emotional, and can be solved. Sex is not just a physical act, it's emotional glue, it's connection, it's communication. When it disappears without explanation, relationships suffer. Let's break the silence with truth, compassion with science. Is this touch you, help you, or make you think? Share it with someone and don't forget to like, comment, and subscribe to Dr. Sunrise for more conversations that matter. We don't heal by hiding. We heal by talking. Then let's talk. Thank you.